Good afternoon, everyone. Thank you for joining us today. Today, we are joined with the OFMQ team to talk about some of their rural health clinic technical assistance areas. If you recall, we did a stakeholder assessment earlier in the summer, and so we're working to develop partnerships, collaborations to help meet some of the needs of our rural health clinics here in Oklahoma. And so Jason's going to give a brief overview. This complements the email that I sent out a couple weeks ago. We'll also be sending out I'm recording this. We'll send out the recording along with the PowerPoint and the flyer again for signing up for services. And with that said, Jason, I'll turn it over to you.
Okay, thank you very much, Laura. We appreciate it. My name is Jason Feltz. I am a health IT manager for the Oklahoma Foundation for Medical Quality. Hopefully, a lot of you are familiar with our organization, but if not, we'll kind of give you a little overview of who OFMQ is and what we do, and then talk about more specifically the service lines that we will provide through the OORH contract. So our organization is actually celebrating our 50-year anniversary this year. We have been in existence since 1972. So we have been serving Oklahomans and in the healthcare realm for quite some time. We are a not-for-profit organization. We work primarily off of grants through federal, state, private entities, and then do some commercial service lines as well. Again, we are your trusted healthcare resource. We really have a broad engagement. So I think that's one thing that really helps sets OFMQ apart, is we work with all different kinds of healthcare settings. So we work with huge hospital systems all the way down to tiny, small, independent, critical access and rural hospitals. We work with extremely large multi-specialty physician groups down to one providers out in Guyman or Idabel or all four corners of the state. And we really have a team of experts from all of these different areas. So we've worked in long-term care, we've worked in hospital settings, we've worked in clinics. So we have a variety of expertise and knowledge across these different healthcare settings and entities. And then I've also got a link down here to our website. I will give a shout out to some people at OFMQ. We've been redesigning that and added some new things just about our organization and about some of our projects. So make sure you take time to check that out as well. So just a little bit more about our experience. Some of you that have been in healthcare in Oklahoma for quite a while may recognize our name from the QIO days. So we served as the quality improvement organization for the state of Oklahoma for 45 years. That contract got regionalized years ago, but we still do a lot of the same type of quality improvement services and projects that we did back then. We also served as the Regional Extension Center for 6 years. That's where myself and a lot of our health IT team got our start. So as everyone was being switched to electronic health records and hearing about meaningful use and these different incentive programs that were coming out, OFMQ was kind of at the forefront of that. And we were the entity here in Oklahoma charged with helping everybody move to electronic health records and meet different quality components within the EHR. We've worked in hospital quality measures for a decade and a half, analytics for quality programs. So we've been both involved on the measure development side, so actually putting measures together that then get approved by CMS and released, and also as well on the opposite side, helping those facilities to meet and improve their quality measures as well. We've been working with value-based payment programs for over a decade now. Case review is where we really got our start before we even became the QIO. So we were just a case review organization, and we still do case review today. So we've got a contract to do Medicaid case review. We do hospital utilization review. So still a big component of what OFMQ does today, almost 50 years later. And then HIPAA solutions. So as you know, with everyone moving to the electronic environment, security has become a lot bigger issue in healthcare. And so we stay up to date with all of the latest and greatest on HIPAA security and what you need to do to keep your organization safe. And then long-term care quality improvement. So as I mentioned, not just hospitals and clinic setting, but long-term care in a lot of different realms throughout the healthcare. So our difference, I've talked a little bit about this already, but we're experienced. We have a diversity of clients. So chances are we have worked with a practice or organization that is similar in size to you, that operates like your organization. And I think that helps us to be able to scale different projects or different assessments and things that we do to help fit the needs of our clients. We give hands-on engagement. So I know since COVID, everybody's gotten a little bit more comfortable in the virtual setting, and we are happy to do that. But we also still love getting into clinics, into hospitals, getting out in communities, and really helping people to improve with that hands-on aspect as well. As I mentioned, we have intelligent staff with a diverse background. So not only have we worked in a lot of different healthcare settings, but we have a lot of people with different experience. We have people that have worked in primary care practices, people that have worked on the vendor side of things, people that have expertise in coding, health information management. So we really have a diverse team here at OFMQ. And that's another benefit that I think that we provide is when you work with OFMQ, you'll get assigned a representative to help you out, but you don't just get that one representative, you get the whole team. So you get the whole kind of wealth of knowledge that comes with the organization. And we take practical approaches and we're local. So I actually live out in Western Oklahoma. We have quite a few staff members now who live in different rural communities throughout the state. And then about half of our team lives in Oklahoma City. So we've also got a variety of experience, both living and working in rural and metro environments too. So the service lines that I'll get a little bit more in depth on today are offered through the Oklahoma Office of Rural Health through this RHC program. So OFMQ is specifically offering service lines to help with quality improvement or performance improvement, compliance education and training, and patient-centered medical home certification assistance. So I'll get into a little bit more details of what specifics we can provide through those service lines. And then we'll have a little bit of time at the end for questions. And so OFMQ's methodology, I want to talk briefly just about how we are going to operate under this contract. So as I mentioned, we like that hands-on feel, but know that that is not necessarily practical or applicable for every situation. So we are going to provide education and assistance through a few different methodologies. One of them is going to be learning and action networks and stakeholder engagement. So we want to show improvement by working with facilities, organizations, professionals to kind of share information, work together to improve not only your own healthcare organization, but regional healthcare outcomes. We're also going to provide affinity groups, so getting people together based on maybe disease states that they're focusing on, or based on regional things that they're working on together, to basically just be able to provide support around shared goals and outcomes. And then I also mentioned the technical assistance, so both on-site and virtual, we can help specifically to complete assessments within your practice, provide feedback, do some different coaching and facilitation. So a lot of different options there. And then also through environmental scans. So you may not even know where you need to start. You may think, yeah, we've got some things to improve on, but we can't even really wrap our head on what patient population to target or what disease state to target. So we can kind of help come in, do some assessments and narrow that scope down for you a little bit as well. So the first service line that I'll talk about is quality and performance improvement. This is really kind of, I'll say, the bread and butter of what our health IT team does at OFMQ. So quality improvement is always at the center of everything that we do. We work in a lot of different grants across the state. Some of them are focused on COVID vaccinations, some of them diabetes prevention, some of them dementia. But at the root of all those grants, we're working with providers, we're looking at quality measures, we're finding ways within their EHR systems that they can improve efficiencies and show that through the data that they are making those improvements on patient outcomes. We like to use that data to drive change. You can talk to people in clinics all day and they can kind of tell you what the issues are or what they experience most with their patients. But if you don't have the data to support that, then it's hard to make changes. It's hard to evaluate how you're doing within that change process. So OFMQ can kind of walk you through all of that. We develop different provider dashboard reports. So that may be within your EHR to help you customize the tools that are available. Or if it's a bigger scale project, we can work to build some different dashboards and find other ways to visualize that data to help you with process improvement. I will mention that OFMQ is vendor neutral, so we don't support one specific EHR software or any vendors like that. Will work with you regardless of what software you use. And we don't provide any software technology ourselves. So we're just helping to connect you within your EHR to other third-party reporters and just make sure that, again, that data is flowing seamlessly and helping you to improve within your organization. We can also do this in a lot of different settings. So we can help you if you would like us to come in and talk with your nursing staff. Maybe you're wanting to work with your back of office more on data collection and reporting processes. We can help kind of tailor those needs to a classroom environment, to one-on-one type training, really sit down with you, dig into the EHRs, whatever the needs of your organization are, we can help with that. We also like to work to where we don't just walk you through it, but we leave you with tools and resources that are going to help you and help to improve your workforce. So if you are working on, say, a diabetes measure, we'll take some screenshots within your EHR to make sure you're documenting medications in the right place, documenting their lab results appropriately, documenting any follow-ups that you have going on. So we will work with you to make sure that you have the tools to do that and to work with your staff so that you don't just have to memorize the process, but have those things to go back to time and time again. I do just want to give you some examples real quick. These are some dashboards that we have developed in the past. Again, we've used a software called Tableau. We've helped customize within the EHR. But whether it's looking at clinical measures, whether it's looking at process measures like health information exchange or patient portal communication, we can help you to evaluate that and really get a better grasp on the data analysis side of things. As I mentioned before, we have a lot of different projects going on throughout the state. I think that benefits us as an organization too, in that we have experience with a lot of different measure sets. We work on care transitions and referral management. So we're very big into the health information exchange, sending and receiving of electronic information. We work on a number of programs looking at opioid use and misuse. So looking at opioid specific measures within your EHR, making sure that you're documenting in the correct systems, checking PMP, have all of those procedures in place to provide the best clinical care possible. Diabetes prevention program, we actually work with the State Department of Health on an 1815 grant. So we look at measures on stroke prevention, hypertension, diabetes prevention. So a lot of those kind of health outcome measures, we have a lot of experience working with as well. Public health emergencies, so making sure that you're connected to those public health registries for immunizations, for syndromic surveillance data. Hopefully we're not going to have to experience another pandemic like we did before, but just anytime those public health requirements are changing or you have reporting or connectivity needs, those are things that OFMQ can assist with as well. We also work in dementia care, as I mentioned, a number of different chronic diseases, food insecurity, so really getting into some different social determinants of health, and then different echo projects. So across different software platforms, using different technology, telehealth, things like that as well. Within quality improvement, we want to work with you to identify measures and select the ones that are most applicable to your practice. So we want to look at things that are really going to capture your patient population and the outcomes that you are trying to improve upon. We help with evaluation of baseline performance, so looking at where you have maybe been at within the EHR the past couple of years and setting goals moving forward. Helping with that gap analysis and strategic plan of how you're actually going to improve upon those measures, workflow, process changes, different ways of documentation, different places of documentation. Then also getting into performance indexing. So not just looking at how well you have done or improved from baseline, but how you compare to other clinics or other like entities statewide or nationwide. Communication, so working on communication, not just with staff, but with management, with patients, and with those process outcomes. And then attestation. So a lot of times we are selecting those measures to improve patient outcomes, but they typically will tie back to quality reporting programs, so that making sure you're checking all the boxes, reporting the information in the correct places, and getting credit for the hard work that you're doing. And then just again to touch briefly, so within our quality improvement, specifically for this project, we'll be working with those rural health clinics. You don't have to participate in the merit-based incentive payment system, but a lot of those processes and clinical quality measures are applicable to what you're doing. So you may also be participating in an accountable care organization or other alternative payment model. We can help provide assistance and attestation and reporting for that. As I mentioned before, the care coordination, so sending and receiving electronic information, connectivity to health information exchanges, and getting on board with the state's HIE once that is up and rolling along, and then public health reporting. And then the last piece is the person and family engagement. So making sure that we're providing enhanced communication tools for patients, ways that they can communicate with the providers outside of office visits, and then just having that electronic connectivity. Moving on from the health IT quality improvement and performance improvement, I'll get a little bit into compliance education and training. So for compliance education and training under this scope of work, the two categories that OFMQ is focusing on is going to be your RHC Program Evaluation. So within that, looking at clinical documentation improvement, some different utilization review, and then your internal policies and procedures. And then also risk management. So looking at your security program, security awareness and training that you have in place, and then contingency planning and emergency preparedness for your organization. So in regard to your biannual program evaluation, OFMQ can do a clinical record review. So like I mentioned with the clinical documentation improvements, we can look at how your current documentation is, provide some recommendations for improvement based on that. And again, just making sure within your EHR that you're hitting those discrete data fields so that on the back end, that reporting is coming across properly. Utilization review within that program evaluation. So we'll help you look at those E&M codes. We'll help you see what types of visits your patients are most frequently coming in and help you with an analysis of that. We can look at your CPT codes, so running different reports on what codes you have, and that may also, again, tie back into identifying measures and other items for quality improvement goals. And then also looking at your Medicare and Medicaid utilization. So just kind of looking at some of those cost reports and how you are doing compared to other like facilities. Another element of this is your policy and procedure review. So looking at how you document your policies, how you communicate changes and updates, what the approval process is, how they get put into place, and then just a review of your organizational policies and procedures to see if you have any gaps, to see if there's other items that we would recommend or different sample policies that we can help you put in place. That's something that we also will help customize. So I will say with anything policy and procedure wise, those always will get customized to fit your organization. You never want to put anything in place that's generic. You're better off not having a policy than you are having a generic one that you don't follow. So we really want to work hand in hand with you to customize ones that fit your organization and your needs. And then just assistance with that report preparation and review that you will be turning in as part of your program eval. Now I'll get a little bit more into the risk management services within compliance. So within risk management, I think people hear risk management and automatically think about the risk analysis that they have to do. That is a small little piece of managing your risk. So when you're talking about a security program, you want to look at the scope of your security program. Are you planning for a larger organization, multiple facilities, just one building? What is it going to encompass? Within that risk assessment, there's different things that we can get in and look at, interviews with staff, documentation review, artifact capture, so making sure you have those logs, policies, other things in place, and then control capture. So what do you have in place to prevent risks from happening? OFMQ has a tool that we use for this. With that tool, we would provide you with a results report and recommendations specific to your facility. We're always going to tie those back to specific security or NIST guidelines. And then making sure that this life cycle is continual. So making sure that you don't just come in and do an assessment, but you're going to do something with those results based on it. So within the risk assessment process, as I mentioned, your risk assessment is part of your overall risk management process. So the risk assessment that we come in and do, we define your scope, again, organizationally, the size, what is feasible for you to be able to do or not. Assess what current security measures you have in place and identify any vulnerabilities based on those. Not only do we identify the vulnerabilities, but we get deeper into it and look at the likelihood that an event might occur. So those vulnerabilities, the likelihood that it might occur, and then that all gets figured into a risk level for each different line item that we're looking at. And again, documentation of all those findings and a big report that we put together to help kind of guide your risk management process. So as I mentioned, you have the risk assessment that you do as part of the risk management process. This also includes any security consulting. So if there's things outside of your organizational capacity, that's where someone like OFMQ could come in and provide additional tools, feedback, recommendations to help you improve upon your security. Policy and procedure development, risk management meetings, and then continuous improvement. So where we typically see most people fall into a trap is getting the risk assessment done and then doing nothing with it. So we want to be there with you and ensure that you are compliant in this process and that you are showing continual improvement. And within that risk management lifecycle, like I said, we'll identify the gaps during the risk assessment and then prioritize activities. So you'll get a report that identifies your vulnerabilities, assigns that risk to them, but we know that all of those risks can't be fixed overnight. So we'll help to work with you to prioritize those risks. There may be budget constraints, there may be workforce constraints, whatever it is, we'll work with you to kind of prioritize those, formulate a strategy to improve upon those or correct those deficiencies and get those controls in place. And then constantly validate that security. So not just putting a new policy in place, but checking to make sure that people are adhering to it and that it is achieving what you set it in place to do. Another part of the big security management program and compliance that we can help with is your security awareness training. So yearly, you should conduct security awareness training with your staff. They should be able to identify different threats and vulnerabilities that occur within your organization. And your training really needs to be geared towards your staff's workflow and activities. It's one thing to go in and tell them, you know, you need to lock your computer, you need to not leave patient information laying around. But it's another thing to really kind of put it into action, to give them real life examples and to weave it into your workflow and operations so that it's more ingrained in your staff. That's why we want to provide examples. So as I mentioned before, just with the clinical documentation improvement or process improvement, anytime that you can show screenshots or help to walk people through those processes, it will just help to reinforce that. Provide example applications, email and stories, and then identify personal or relatable experiences. And then constant communication. So as far as HIPAA security rules and making sure you're compliant, you need to do annual security awareness training. But again, annually is not enough. If somebody tells me something one time a year and expects me to remember it, I'm probably not going to retain all of that. So make sure that you're taking pieces of that training, sending out reminders, talking about it during employee meetings. Make security and risk management part of your compliance culture within your organization. So along the lines with that security awareness and training is education. So policies and procedures, as I mentioned, if you're doing security awareness and training, it's great if your staff is informed of what the security rules are and know the basics of them, but it's even better if they know how to apply them to your organization. They know which policies and procedures apply to those, and they're familiar with them. And then make sure that you're customizing this training on job roles. You want to train all of your employees every year, but a physician may need a different type of training than a billing professional. So make sure that you're customizing that training to the needs of your staff and employees. OFMQ will also help with the trends, threats, and industry weaknesses. So we have security staff that stays up to date with this information, just like we do with quality reporting programs. We've got examples of HIPAA breaches, of hacks, of different common security threats that are happening to organizations in Oklahoma and across the United States. So we want to help you to be aware of those. And use those case studies to make yourself more secure and prevent any breaches that may occur within your organization. And then just again, as I mentioned, making it a culture of security. So the more that you talk about it, the more you kind of ingrain it into what you're doing, it becomes less of an eye roll from your staff when they're thinking, oh, HIPAA, oh, computer stuff, here we go again. So when you're talking about it, when you're providing real life examples, that's where you can really make a lasting impression. And that's where OFMQ can help. We also partner with some other organizations, as I mentioned, just to stay on top of everything going on security-wise. So InfoSec is a partner of ours that helps with some of our different security lines. But all of the security training that we do is going to tie back to NIST standards. So we're going to find the things that are happening most frequently, those high impact items, those kind of new things that we're hearing about in the security industry. So this can include phishing, working remotely, which is a huge one, especially since COVID, password security, social engineering, safe web browsing, malware, physical security. So I do want to mention, we don't just look at your technical environment. We look at your security as a whole organization. So we look at organizational aspects, we look at administrative aspects like policies and procedures, we look at physical aspects like cameras, door locks, lighting, and we look at your technical environment. So your server logs, the encryption, different capabilities that you have in place and are using. Mobile security is also a huge one, as well as removable devices. Also in line with compliance, and this just kind of ties in with the risk management service lines, but I did want to mention it, is we can also provide support on different compliance aspects within security. A big one of those is your business associates. So making sure that you have agreements in place, we can help review those agreements, give feedback on them, making sure that you're tracking them so that you know who you have active agreements with, who you need to get a new one signed from, have there been any changes in the personnel that you're working with, and making sure that's all up to date, and then obtaining assurances from those business associates. So yes, you're submitting a document every year and they're signing off on it saying that they're doing something, but are they providing any proof? Do you have any type of assurance that they're actually meeting the standards that they have agreed upon? And so we can help oversee that process within compliance as well. And then also auditing. So specifically to prevent and investigate within your security management plan. So we want to look at detection of when certain conditions are met. So looking at accounts logs, access to the building, access to the system, how do you get rights to the system, and making sure that alerts are in place for those, tracking. So looking at log in, log out, a lot of different log and change request tracking there, and then reporting. So making sure that you're compliant with the type of reporting that you have to do. Making sure that you're up to date on the breach reports, know based on how many cases it is, if you need to report immediately, if you need to report at the end of the year. So just making sure that you're tracking all those things and staying in compliance as far as auditing and activity investigation. The last service line that I will discuss through this project that OFMQ will provide support on is the patient-centered medical home certification. So if you're not familiar with patient-centered medical home, it's very descriptive within the name. It's a way of providing care that really puts the patient at the center of everything that you're doing. It incorporates the patient into shared decision-making, making sure that they are informed and aware of their different treatment preferences, and making sure that they're taking an active part in their healthcare role. And this includes everybody in the practice. So what it really looks at is breaking down silos and making sure that everybody from the receptionist to the billing professional to the clinical staff is involved in that patient care and aware of what's going on with those individuals. So OFMQ through this contract can provide assistance with different steps throughout your PCMH certification process. We can help you with eligibility. So looking at eligibility from an individual clinician standpoint or from an organizational standpoint, and making sure that you have the right things in place from that aspect. The recognition and evaluation process, so making sure that you have everything in place that you need, and while you're applying for that PCMH certification, that you're meeting all of your needs during that evaluation period. We can help with achieving your standards, different optional distinctions. So if you're looking into a behavioral health distinction or some of those, we can provide additional support and guidance there. And then also with your annual reporting and auditing. So one of our biggest things at OFMQ is we want to see you succeed in whatever you do. So with PCMH, we don't want to just see your organization get certified as a patient-centered medical home, we want to see you succeed. We want to see you improve patient outcomes and provide better care, not just meet that certification. So we'll work with you to achieve that certification, provide assistance in any way that you need it, with technical assistance, organizational leadership, that patient and family engagement component. And then again, as I mentioned before, with your quality improvement, process improvement, making sure that you have the tools in place on the back end to monitor and evaluate your performance. I won't get into all of these standards, but these are examples of the different standards that OFMQ will help support your practice in achieving. So we'll work with your staff to educate and ingrain these things within your workflows. So team-based care and practice organization, knowing and managing your patients, that patient-centered access and continuity, care management and support, care coordination and care transitions, and then performance measurement and quality improvement. So as you can see, as you're going through these different standards of PCMH recognition, it really incorporates a lot of what we have talked about previously through some of our other service lines of that quality improvement, performance improvement, care coordination, and that patient access. And then again, help you with any annual reporting requirements that arise with maintaining certification and submitting all of your information and data yearly. I will go ahead and pause here and open it up for questions. So I just want to thank Laura for having us today to talk more about the service lines that OFMQ provides. And then just reaffirm that wherever you're at in the process, if you need help getting started, if you've maybe done some assessments and just need help with data analysis, wherever you're at in your journey with any of these service lines, we're happy to help. So we work with all different sizes of organizations and all different organizations who are in different parts of their quality improvement journey. So we appreciate your time and we are here to help.
All right, thank you, Jason. Does anyone have any questions? Before we get into questions, I do want to note, I know we have some folks on the call who are either currently participating or will be participating in our next cohort for the RHC QI project activities. And these are not competing priorities or competing programs, but rather complementing programs. And so we've heard this past year with our national cohorts that running the reports in the EHR or getting the data points out of your EHR has been a hiccup, not just for Oklahomans, but other states who are participating. And so we thought this would be a great collaboration. And then also, as Jason mentioned, being on site, being available, being in state to help with the PDSAs, setting those up, providing training to your staff, kind of being the third party to be providing that education and moving those data points along. So with that said, do we have any questions or comments? All right, if not, if you would like more information or if you'd like to get in touch with the OFMQ team, Jason's email is there in the middle. And I did send out that email prior to this webinar, and at the bottom of the flyer, there's a button you can press that takes you to a form to complete to kind of guide you on what specific items you're wanting to work on. If you have any questions at all, please feel free to reach out to me. Again, we are recording this and I will be getting this out to everyone along with that flyer with the button to follow up. So thank you guys. Thank you, Jason, for your time.
Thank you, Laura. We appreciate it.
All right. Thank you, everyone.